The Americans who were aboard that Hantavirus cruise are back in the States tonight. They're in quarantine and under observation at the University of Nebraska Medical Center. We're also learning more about the Californians linked to this outbreak. And joining me now is UCLA epidemiologist Dr. Anne Ramoyne to discuss. Thanks so much for being with me, Dr. Ramoyne. Let's start with this. Health officials are monitoring 4 Californians exposed to the outbreak. We know one is in Sacramento County. We learned that today. One is in Santa Clara County, and then 2 are under quarantine in Nebraska. How concerned should we be as Californians?
Well, I think that this is a great situation in the sense that we know who was exposed. We have them under quarantine. They're not going to be they're going to be monitoring their temperatures every day, looking for symptoms. They're going to be in very close contact with the Department of Health. And if somebody gets sick, then they're going to be able to be transferred to care right away, which is critically important when you have a hantavirus case.
Absolutely. So the hantavirus is a series of viruses, and under that umbrella is the Andes virus, which is a hantavirus. We've learned that this is the Andes virus. What's the significance of that? What does that mean?
Well, hantaviruses are a family of viruses, and we have hantaviruses right here in California. We have a few cases every year, like we've had in Yosemite. This particular hantavirus, the Andes virus, is endemic in Chile and Argentina, and it is the only hantavirus that is known to be able to spread from person to person. So it'll be transmitted from typically this long-tailed pygmy rat, which is in Argentina and Chile, the reservoir species. And then from there, sometimes you'll see person-to-person transmission.
Okay, so this idea, though, of person-to-person transmission, when people hear that, they immediately, alarm bells start going off. So I just want to get to that again of how alarmed should people be knowing that it is the Andes virus. Are we looking at another pandemic? Because I know that people associate this with the coronavirus, but they're 2 very different things, right?
You're absolutely right. You know, when it comes to infectious diseases, it's not all or nothing. It's not no problem at all or global pandemic. There are very serious infectious diseases that if you are exposed to them could be very serious for that person and potentially transmissible to another person. But many of these are not transmissible enough that they're able to spread quickly from person to person to person to person and create the situation of a global pandemic. This virus is very serious for the people who've been exposed to it, but it doesn't transmit as efficiently as something like COVID. You have to remember this has a really long incubation period. So if with COVID, incubation period was just a couple of days. This is many, many weeks. So if you know somebody has been exposed, you're able to, generally speaking, now that we know that we're dealing with this particular virus, get them into isolation and limit contact, which is just something we weren't able to do with COVID, given how short the incubation period was.
We have less than a minute left. The incubation period is up to 8 weeks for the Andes virus, for the hantavirus. Does this mean that we have to wait 8 weeks from right now until we can breathe a sigh of relief?
Well, for the people that have been exposed, it's going to be a very tense couple of weeks for them because this virus can be very, very serious when you get sick. So, yes, these people will be being monitored for that extended period of time. Mm-hmm. It's generally between 2 and 6 weeks that this virus shows up, but it can be up to 8 weeks. I think it's just really important to remember that, there are a lot of people who they're people who have died. There are, people
Right.
who are sick, and there are people that are exposed who are very, very worried right now. And because this virus is not generally something we worry about in terms of a global pandemic, we should just be very glad that these people have been in a contained environment. Most of these people have been on a ship. They haven't been mixing in general populations. We know what we're worried about now.
Right.
And those people are identified and under quarantine.
All right. We will continue to follow it, as you will too. Thank you so much, UCLA epidemiologist Dr. Anne Ramoyne. Thanks again.
Thanks for having me.